Hi, I'm Dr. Martiny and I'm part of May Grant Associates. I came to May Grant approximately 8.5 years ago and have never looked back. My training started in York where I did my residency and then basically took my first position here and have been here ever since. One of the most common questions that we get at May Grant when patients come in for their appointments is what their options for birth control are. Most patients that come to us at one point or another have had some kind of exposure to birth control in one fashion or another. In this country, there are a ton of options which can make things very, very tricky to figure out what the best option for a patient is. Just looking in general, patients can choose between pills, patches, rings, shots, implants, IUDs, barrier methods, and even go all the way to the other end of the spectrum and do something permanent like a tubal ligation. The tricky part about figuring this out is that a lot of patients just don't know what their options are, and even when they do know some of their options, they don't know exactly what's ideal for them based on their lifestyle or based on if they've had kids or not. So there are a lot of questions that come up. In general, the most basic form of birth control is something like a birth control pill. That's something that you take once a day, every day, for the entire month, have a period at the end of the month usually, and then repeat the cycle every single month as long as you want to take the pill. When you move beyond pills, then you have things like rings, something called the Nuvaring. There are shots, which is called Depo Provera. There are still patches that you put on your skin as birth control. And then there are also implants that are longer term type options. With a lot of these options, the advantages to them over others is that maybe you don't have to worry about them as often as taking a pill, for example, every day. So something like a Nuvaring, you place once a month, you leave it in for about 3 weeks, you take it out, and then you have a period for about a week, and then you repeat that process. The patches, for example, you put a patch on every week, leave it on for a week, repeat that for 3 weeks, and then have a period at the end of the month. Depo Provera, which is the shot, is good for about 3 months at a time. So as long as you come in about every 3 months, we give you your next shot and you walk out the door and you don't have to worry until the next shot. Apart from that, you can get into the longer term type options like implants or IUDs. Now these are a little bit trickier because picking and choosing can be based on timing as far as how long you want it to last, or maybe you're scared of needles and don't want something in your arm. IUDs have traditionally gotten a bad rap if you look on the internet, because there are so many stories about insertions that weren't appropriate and that kind of a thing. We would tell you to make an appointment with us. An appropriately placed IUD is actually one of the most effective forms of birth control apart from abstinence or getting your tubes tied. We're not scared of IUDs. We do them all the time and patients do great. We also have the option of doing a tubal ligation if you know that you've finished having kids. That's a simple little procedure that you come in, you get done as an outpatient surgery, and you get to go home within a few hours. At the end of the day, the most important thing is to know that you have a lot of options, but we're here to help you. And we're here to help you talk through all of those options and try to pick something that is appropriate for you. If you have any questions, give us a call. We'd love to see you. Make an appointment with one of us, and we'll take good care of you.